right, next we have Dr. Pittman's group from the psychology department.
Welcome to our presentation on the specific role of GABA-A receptors in modifying taste perceptions in rats. I'm Taylor Owen.
I'm Reigel.
I'm Elizabeth Haltiwanger.
I'm Brittany Joyce.
I'm Kentrice.
And I'm Belle Scott.
So, as you're probably aware, obesity is a growing problem in America and other industrialized nations. Our bodies have two natural ways to regulate food consumption, hunger and satiety. So hunger obviously signals to us that we need to eat, and satiety signals to us that we are full. However, there are other factors that can influence this hunger and satiety system. One of these is taste palatability. So some people may have food that tastes better and not even notice that they're overeating and therefore gain weight. So we've noticed this in patients who have been prescribed anti-anxiety drugs, and so previous research was conducted on the effects of anti-anxiety drugs on the consumption and palatability of food, because people who are prescribed anti-anxiety drugs often gain weight as a side effect. So this research showed that the benzodiazepine class of drugs does not only increase food consumption, but appear to also change the taste palatability to make food taste better. Moving forward, we wanted to look into a question that was raised by other labs, which is, what is it about the anti-anxiety drugs that affects the taste system? So we decided to see how another anti-anxiety drug with a different chemical makeup to benzodiazepines would affect taste consumption and reactivity. So this other drug that I'm talking about is buspirone. It has extremely comparable effects to our benzodiazepine, which is chlorodiazepoxide, on anti-anxiety, but it has a completely different chemical makeup, as you can see. So buspirone acts on serotonin and dopamine receptors, while CDP acts on the GABA receptors by increasing the inhibitory effects of GABA. CDP's effect on GABA has a known effect on taste and consumption. So we wanted to compare buspirone to CDP to see if they had any similar effects.
All right, so past research used 10 milligram per kilogram doses of CDP. So we used 5 milligrams per kilogram of CDP, and to see if there's a dose-dependent effect. And then we also used triple the amount of previously used buspirone injections, which was at 1 milligram per kilogram. So we used 3 milligram per kilogram to see if there was any effect at all, because past research showed no effect. So basically we just upped the buspirone and decreased the CDP to see if there was any change that we saw.
So the method of our experiment, we injected rats with either CDP, buspirone, or saline as our control. And we used saline as our control because CDP and buspirone were dissolved in saline. So that was the solution that we decided to use for our control for that reason. And so rats were assigned to either one of the two drugs or the control throughout the entirety of the experiment. And so we were looking to see if that drug that they had been given over the course of a few months would affect their lick rate to the different tastants. So for the appetitive tastant, we use sucrose, which is a sweet taste. And for our aversive tastants, clearly there are more, we used sodium chloride, which is our salty tastant, quinine, which is bitter, citric acid, which is the sour tastant, saccharin, which is a combination of sweet and bitter, and umami flavor, we used MSG. Lastly, we used capsaicin, which is not a typical tastant. Instead of acting on the taste pathway, it acts on the touch pathway. So it's more of a pain or heat. So think about eating a chili pepper. That's the tastant we use for that. So for our methodology, we used a Davis rig. So there's a little video playing in the top right where you can see one of our rats inside the Davis rig. So you'll see that shutter open. So the shutter has opened and the rat will notice it, and then it will begin to lick. And so the Davis rig calculates how many times the rat licks to a given concentration of that tastant. So for the tastants that we just showed, we had varying concentrations of all of those, and they were lined up in the Davis rig in mini tubes. And then once the shutter closes, you see the stimulus tray move, and it's replaced with a different tube and a different tastant. So each rat, we calculated the max number of licks that a rat is capable of doing. It's a lot, it's like hundreds in a second. And so we calculated the max for that rat, and then standardized the number of rats, or the number of licks to each taste-in, so that way we could get a quantifiable number across the rats. So that's our standardized lick ratio, so all the graphs that you see of our results will be depicted in that standardized form.
Now for our results, just to kind of set the graph up for you all, you will have the taste-in with its many varying concentrations on the x-axis, and the standardized lick rate on the y. Number 1 is going to be your maximum lick rate. So here we have our appetitive is sucrose. As you can see in the buspirone rats, there is a sedative effect, so they lick less to water. We really don't see any other effect of the drug there. For CDP, however, we do see a significant increase to the licking of the taste-in, specifically at the lower 2 concentrations, as indicated by the plus sign, which is a p-value of less than 0.001. Now for our aversive taste-ins, the rats are water deprived to get them to lick to these because they don't like them. So you will see their maximum lick rate in response to the water. For buspirone, again, we have the sedative effects, and we really don't see any other effect of that drug. For CDP, however, we do see a significant increase to the sodium chloride at the highest 2 concentrations. For quinine, again, we see a decrease to water, as well as a significant decrease to the lowest 2 concentrations of that taste-in in the buspirone rats. And then in the CDP rats, we see an increase in licking to the median 2 concentrations of the taste-ins. For citric acid, we really don't see a difference until we get here to the 30 millimolar, and then we see a significant decrease there. For CDP, we see a significant increase at the highest concentration of citric acid. For saccharin, we see a large effect of the drug here for the buspirone rats. We see significant decreases in all concentrations. For CDP, we really only see a significant increase at the highest concentration of 25 millimolar. For MSG and the buspirone rats, we see a significant decrease at all of the concentrations except for the highest concentration, and again, the sedative effects to the water. And then for CDP, we see a significant increase at the highest 2 concentrations. And finally, for our non-tastant capsaicin, we see a surprising significant increase for the highest 2 concentrations. But for CDP, we really don't see an effect of the drug there. And this was surprising because this really shows to us that the GABA receptors in CDP are acting on the taste pathway and not the touch pathway. So as we said, that capsaicin acts on a touch pathway. It's more of a touch sensation rather than a taste. And so that really just specifies that the GABA receptors in this drug are acting on your taste and not your touch.
So as mentioned before, previous research has found that 1 milligram per kilogram of buspirone did not reduce the licking of the rats licking to the taste-ins, but it did decrease their licking to the water. So our study found that increasing the dosage of buspirone to 3 milligrams per kilogram decreased their licking to almost all of the taste-ins, including the non-taste-in stimulus, capsaicin, and water. And this is most likely due to the anxiolytic effects of buspirone that created a really sedative effect and causing the rats not to lick to any of the taste-ins.
So previous researchers examined the effect of a 10 milligram per kilogram dosage of CDP on the perceived taste-in appetitiveness of taste-ins. And that research suggested that the 10 milligram per kilogram dosage had an effect to which it increased taste-in appetitiveness across all taste-ins. So in our research, we reduced that dosage to 5 milligram per kilogram CDP, and that still had the effect of increasing taste-in perceived appetitiveness across all taste-ins. In regards to the citric acid and capsaicin taste-ins, we saw that there was no significant effect. We're not really sure why there was no effect on citric acid quite yet, but we do know that there was no effect on capsaicin because capsaicin is perceived through the touch pathway as opposed to the taste pathway.
So we expanded upon past research by just using different concentrations of CDP and buspirone, and in line with past research, we found that CDP increased appetitiveness of taste-ins. and that buspirone decreased them. And then we found also that no effect was found of CDP on capsaicin, and capsaicin's in the taste, or not taste pathway, the touch and pain pathway, as Belle said. And we found the opposite effect of buspirone, so, which also works on serotonin, dopamine, yeah. So we can suggest that GABA-A drugs such as CDP act specifically on the taste pathway, and we can further suggest that using anti-anxiolytic drugs such as CDP might increase your risk of gaining weight because food tastes better when you're on these drugs.
So for future direction, we felt like it would be beneficial to examine the effects of pH on sour tastings, because our research showed that there was not really an effect on the sour taste, so we would like to examine that further. It would also be beneficial to lower the dosage of CDP, because we're trying to get CDP to a dosage to the point where there is no effect on taste and appetitiveness.
So initially we thought that we could go from 1 milligram per kilogram of buspirone from the previous research to 5 milligrams per kilogram, but we found that that dosage caused a really sedative effect on the rats, and they did not link at all to the tastes. So we lowered the dosage to 3 milligrams per kilogram that was used in our study, but we found that that dosage still created the sedative effects. So for future studies, we would like to lower the dosage again to 2 milligrams per kilogram to see if there is some sort of middle ground between 1 and 3 milligrams per kilogram that eliminates the sedative effects of the drug.
We'd like to thank Dr. Pittman for serving as our advisor. I'd like to thank you all for attending and listening our presentation, and at this time we will accept any questions.
This can be drawn for application to humans. Could you expand on that a little bit, saying how much these studies will have implications on the effects of these drugs in human consumption?
Yeah, so one of the main takeaways that we found was that if you are on one of those anxiety medications that does act on the GABA-A receptors, it's one thing to be aware of that it may be making your food taste better, and so that you would be more aware of when you're overeating, and that you would maybe take that into consideration when you exercise. Weight gain is something to consider, but obviously the anti-anxiety effects are more important. So we would recommend continue taking the medications, or maybe switching to a medication that does not act on that GABA pathway and instead acts on possibly dopamine or serotonin instead.
I'm wondering if you guys had to cleanse the rat's palate between different tastes, and was there like a cumulative effect? You know, if he or she tasted one and the next, was there any impact of that?
We did not cleanse the palate between each tasting. It was in a randomized order though, and so the way that you saw the stimulus tray move back and forth, it was a lot of the same tasting, just in variable concentrations, and it was mixed in with water as one of the test tubes as well. So we did not specifically cleanse the palate in between each tasting, but that's a reasonable question, but we don't think that it affected the results. So.
And it's important to note that the rats tested every other day. So it wasn't, we had 24 rats and you have 12 that would test on certain days and the other 12 that would test on the days. So they would alternate. So I think maybe that too could have cleansed the palate just for time. So there wasn't necessarily maybe a cumulative effect since they weren't testing every day.
And then in addition, there was a 15-second gap between each tasting, so it gave them time to kind of recover. So it may not have shown it in the video, but the rat kind of like went away and peed itself for about 15 seconds before the shutter opened again. So there was kind of at least it wasn't, you know, back to back to back like that.
Yes.
What made you pick these particular anti-anxiety medicines? Because I know there's some that affect norepinephrine as well, instead of the dopamine and serotonin. And why did you pick these particular ones?
So this lab has done a lot of research with the taste perception pathways, and previous research has looked at the effects of similar drugs that act on these neurotransmitters, and so we wanted to expand upon that research. Obviously, we could start over with a new pathway as well, but we wanted to expand upon what had already been done. But